Video content or information here is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Please also see the written disclaimer with more details below. Thank you. Hi, I'm Dr. Carrie Bennett, and today I want to talk to you about the oncotype DX score. So 20% of people who get breast cancer will need IV chemotherapy to help get that excellent survival. So in the beginning, we ascertain by looking at the pathology. If the patient has a triple negative cancer, that is no estrogen, no progesterone, and no HER2 receptors on their cancer, those people may benefit from chemotherapy before surgery, but certainly after surgery as well. Our normal breast cells contain 100% estrogen and progesterone receptors and do not carry HER2 receptors. And when your tumor doesn't have all three of those, what we know is you're going to need chemotherapy. Most commonly, it's done before surgery because then they might use different drugs after surgery. But sometimes with a smaller triple negative tumor, we will start with surgery. So those people will fall in that 20%, and also people who carry HER2 receptors on their tumors. People will also benefit from chemotherapy. It's a year of chemotherapy, usually given in the first 4 to 6 months before surgery. Then we have surgery, and then the Herceptin, which is a drug you might see on TV or in magazines, is given for a full year afterwards. Then if you have a tumor that is not triple negative or is not HER2 positive, then normally we would start with surgery first. And those people, to ascertain whether or not they need chemotherapy, will need, if the tumor is greater than 6 millimeters, and this would be a HER2 negative tumor with estrogen positivity usually, because otherwise, remember, those people need chemo. So to ascertain if that 20% of people who have an ER positive, HER2 negative tumor need chemotherapy, we have a genetic test that looks at 21 genes within the tumor. So we might do a genetic test of your body if you need to know if you have the BRCA gene or BRIP1, MSH, or any of the other genes, which we can do something about that may affect your therapy. We would then do this 21 gene assay on the tumor, not your body. This 21 gene assay is called the oncotype test, and it ascertains whether someone over 50 or under 50. Now, currently, it's only been validated in women, but we do extrapolate this data to people born of XY. Women are XX. And this is a test that looks at 21 genes to see whether or not you would benefit from chemotherapy to have a less recurrence rate in the future. It's scored from 0 to 100, and if you're over 50 or under 50, there are different ways we look at it. And they're all here in my book and will be available to you. But if you're older than 50, we look at the score from 0 to 25, and that means that you would not benefit from chemotherapy. But if the oncotype score is 26 to 100, we would definitely look at whether or not with your medical problems you would benefit from chemotherapy. Now, if you're less than 50, the studies have shown that it's a little bit more separated. 0 to 15 has a low risk of recurrence, and the benefits of chemotherapy would not outweigh the risks of the side effects. We would not give you chemotherapy if you're less than 50 with your tumor score on the oncotype being 0 to 15. 15 to 20 is called a low to medium risk of recurrence, and we also believe that the benefits of chemotherapy are just not worth it. But if it's 21 to 25, then we start tipping into, yes, likely chemotherapy would help you. And certainly if it's over 26 to 100, we definitely believe that chemotherapy would help you. So again, 20% of people who get breast cancer in general might need chemotherapy. We look at upfront factors such as the receptor statuses to help determine if you need it. Or we look afterwards, if an estrogen receptor, HER2 negative tumor, we look at the oncotype score to see if you need chemotherapy. If If you have a lot of medical problems, we may decide that the chemotherapy with you and your family, we would decide this together, everything is collaborative, that the benefits of chemotherapy may not be worth it. Thank you.